Robin Kaler, the Associate Chancellor for Public Affairs. I'll be your moderator today. Our focus again is going to be on how the university community is navigating the human resource challenges and opportunities to support university employees. One quick housekeeping note, our next briefing will not be next week. It will be the week of August 3rd when we plan to have two sessions, one on the modeling work by two of our prominent researchers and a session for students and parents on what you need to know as you plan for your student to return to campus. So that should be a really, really good one, as will today's. It will also be at the same link as today. And just like today, we will record it, we will closed caption it, and we will post it on the covid19.illinois.edu website. And of course, we'll email you when that's ready. Our panelists today are Andreas Kangelaris, the Vice Chancellor for Academic Affairs and Provost, Elin Cole, the Senior Associate Chancellor for Human Resources, Deb Stone, the Executive Director of Human Resources Policy and Administration, and Leslie Arvan, the Senior Director of Labor and Employee Relations. Our format, as always, will be some opening comments by Andreas, a brief presentation by Deb, then questions from members of the campus community to our panel. So Provost Kangelaris, would you like to get us started?
Thank you, Robin, and thank you all for joining us for this briefing. I'm grateful to Eileen, Deb, and Leslie for being here with me today. I realize that as we move further closer to the start of the fall semester during this continuing pandemic, the issues facing our human resources professionals have grown in scale, quantity, and complexity. So I'm most appreciative that the three of you taking the time to help us all better understand the policies and practices we will be implementing in order to accommodate the diverse spectrum of challenges our employees face as we progress through phase 4 of the Restore Illinois plan, and in order to make sure we provide everyone with as safe of a work environment as possible. I know that COVID-19 has required each and every one of us in our university community to reimagine and reinvent how we work, live, and learn here at Illinois. But I believe there is no operational area of our university organization that has been asked to do more than our HR staff, whether at the central level or those spread across our colleges, departments, and units. Whether you're a faculty member, a graduate assistant, or a member of our staff, the decisions we're making about our operations in the COVID-19 era are related to the policies and practices that govern how we all work as employees on this campus. Our HR professionals are operating full-time at the intersection point of all of our various missions, from research to teaching to service. And that intersection is full of gray areas and complicated answers. I want to commend all of the HR staff on this campus for their tireless work, their professionalism, and for their creativity and patience in helping us all navigate this crisis. And as we have seen with so many other COVID-19 issues, there is still a good deal of uncertainty ahead of us that we'll have to confront. So while we may not have all the answers today, Eileen and the HR working team have been working thoughtfully and thoroughly, and will be able to address some of the biggest and most pressing questions in today's session. I know we have a long list ahead of us. So with that, I would like to turn it back to you, Robin, to get us started.
Thank you, Andreas. And Deb, if you could share your screen with us now and maybe bring us up to speed on what the Illinois HR team has been doing over the summer to get us ready and where you see us going from here.
Sure. So I'm happy to share some of the really critical information that we have been doing. Next slide. So we thought that we would start by just having a brief conversation about what are some key things that we believe it's critically important for all of our employees to know as we return back to our campus operations. And the first is that we really expect all of our employees who are going to be on campus to participate in our free on-campus saliva-based testing that we have developed here at the university. It's quick, it's easy, and it's one of the primary methods that will allow us to really make sure that we know if the virus is present on campus so that we can take quick responses to that. If you haven't already, I would like to draw your attention to two very important resources. And the first is the Return to Campus, What You Need to Know guide. This guide can be found on the covid19.illinois.edu website. It has a wealth of information, and we continue to add information as new decisions and critical pieces of information need to be added to that guide. We are keeping it updated. Actually, Robin's staff is doing a great job of keeping that updated. Also, if you have not yet done so, please follow and take the Division of Research Safety's COVID-19 safety training. This is an online training that is 10 minutes. It's quick. It's a great reminder of the everyday things that each one of us can do to make sure that our campus, community, and environment is as safe as we can possibly make it. You can find the link to that training again on the covid19.illinois.edu website. If you've not bookmarked that website, I hope you will after this presentation. Some things to remember. Maintain a 6-foot distance from others when at all possible. We need everyone, and in fact, we are requiring all faculty, staff, and students to wear a face covering when indoors, unless you're in a private office by yourself. So if you are indoors, you're going to be around others, you are required to wear a face covering. If you have a medical condition that makes face covering very difficult for you, you will need to work with the Office of Access and Equity, the ADA division, and they can help problem solve and work through what options are available to you. All of us need to be very diligent about washing our hands frequently with soap for at least 20 seconds and avoid touching our face. One thing that I think has become clear to many of us is as we've become more intentional about these actions, we've realized we touch our face a lot more than we might have thought we did. And lastly, we want everyone to wipe down surfaces that other people have touched before you touch them if they're high-touch surfaces. And that is a way that you can help to keep yourself safe. Next slide. So you can see on the screen by now what's probably a very familiar graphic of the coronavirus. I want to talk about 4 overlapping lines of defense that we have and show how when we layer these lines of defense on top of each other, how it is that we can really suppress transmission of the coronavirus. So the first line of defense, Chris, is screening and testing. So we are so fortunate at this university that we have our saliva-based test. It is free, it is available, it is quick, and that screening and testing really helps us to be aware and be able to find when we have a positive positive coronavirus on our campus, we can take quick, rapid action to really slow down and mitigate any further transmission. Next screen. Hand hygiene. I talked about this. We need to make sure that we're using our hand sanitizer. We are using, washing our hands with soap and water for at least 20 minutes. We have great resources on this campus that we will have plenty of soap. Of course, we have plenty of water and plenty of hand sanitizer available in our campus work locations. And we need to make sure that we use them. Next. Blocking droplets. So right now we can see very little of the coronavirus graphic. In blocking droplets, this is what our face coverings does for us. COVID-19 is droplet spread, and so the importance of face covering really cannot be overestimated. We keep both ourselves and others in the community safe, and that is the reason why, as a university, we're requiring the use of face coverings in our university buildings. Next. Distancing, the social distancing. Again, look when we layer all four of these actions that we can each take individually, that we have really put a protective layer over that coronavirus graphic. And that's what happens as we move throughout the world as well, when we practice all four of these very easy personal actions that we can all take that makes all of us safer by doing so. Next. So the Illinois Community Pledge, have you heard about it? Have you taken it? I hope that you have. If you haven't, please, again, you can guess the website where I'm going to tell you you can go find the pledge. The pledge is an opportunity for each of us to voluntarily commit to and share with others our personal commitment to the health and safety of all of us. Some things that I want to make sure that we all understand. Taking the pledge is voluntary. We cannot compel you to take the pledge. We hope that we will all voluntarily take the pledge. And if you do, you are not signing away or signing a waiver or obligating yourself into a binding agreement. Again, it's a way that we can all individually share our commitment to keeping this a safe environment. If you use social media, please share that you've taken the pledge with the I've Got You Covered hashtag. And if you do use social media, search on the hashtag and see all of the people who have so far shared that they took the pledge. So I hope you'll join me in taking that pledge. Next. So before we get to the questions that have been submitted, we know that there are three areas that we have really increasingly heard questions, and we know that we want to cover in a bit more detail. So let's start with those. Chris, next slide. So the first one, especially in the last 2 weeks, as our K-12 schools are working on their reopening plans, and their reopening plans are perhaps not what any of us thought the plans would be in March. We thought the plans might be different than what they are. But because of where we are with COVID-19 and the very prudent safety measures that our K-12 schools have to put in place, we're increasingly getting the question from employees, does the university continue to have, what's the attitude towards flexibility and remote work, especially for those of us who have children who are in K-12 schools? So I just want to confirm that, especially with our leadership from our chancellor and our provost, that yes, the university continues to have an attitude in which where remote work is possible, we really want to encourage, and we are encouraging leadership to continue to be flexible with employees who can do remote work so that your children can be safe when they're not in school. As part of the HR work group report, one of the things that will be part of that package that is expected to be released soon is new telecommuting guidelines. Previously, before COVID-19, we would have said usually entering into a telecommuting agreement in order to facilitate childcare is not normally the guidance that we would give in HR. But COVID-19 has caused us to rethink so many of our processes and our practice, and telecommuting and being able to facilitate telecommuting so that our employees can care for their children is one of those areas that we are changing. And our new telecommuting guidelines will speak to that. Also, if the work can be completed remotely, continuing that remote work helps us with our overall density on campus, which helps all of us maintain our social distancing in a much easier way. So lastly, I want to be very clear in saying that the campus does not have a requirement. So we frequently get asked, so is it true that every employee has to return to campus work by the time classes start? And the easy answer to that is no, when the question is asked, does every employee have to do so? Are there positions, especially student serving positions, for example, that the work and those services can only be provided in person? Certainly, we have some positions on campus that simply don't lend themselves to remote work. But there is not a blanket requirement that everyone has to return simply because it's August. So I wanted to clarify that. Chris? Oh, a very frequent topic these days is what happens when there's an employee who tests positive for COVID-19. So the first thing is that as soon as an individual, including our employees, has a positive test for COVID-19, Illinois Department of Public Health and the local health department are notified immediately. And the importance for that is that contact tracing is the responsibility of the local health department. And contact tracing is its most effective when it occurs quickly and as soon as there's notification of a positive test. What the public health employees do in contact tracing is they contact the individual who has tested positive in order to be able to have conversations and understand who it is that that individual, in our case, our employee, has had close contact with. And close contact doesn't mean walking past someone in the hallway, on the quad. Close contact for COVID has a very specific definition, which is being in contact with someone less than 6 feet apart for longer than 10 minutes at a single time when the person was, when one of the persons was infectious, and most likely when face coverings are not worn. So again, if we think back to our layers of defense, if we maintain our social distancing, if we wear our face coverings, those are two key areas that reduce people meeting the threshold for a close contact. So public health determines who meets the threshold for close contact, and then public health contacts those individuals to determine what the steps are for those close contacts. But let's go back to the employee who tested positive. After they have been contacted with public health will inform them that they are required to isolate for a minimum of 10 days. And this is true whether the person who tested positive has any symptoms or not. It's true whether if they have symptoms and their symptoms go away by day 5, they are still required to isolate for that minimum of 10 days. And public health will maintain close contact They will be in constant contact with the employee who is in isolation and let them know when they can be released from isolation. Now, one thing is the employee is not required to share the medical diagnosis with us as the employer, and that's true for any personal medical information. However, especially if the employee is in a job that requires them to be on campus, they need to inform the supervisor that they are unable to work due to a medical condition at a minimum. They are free to share that they tested positive, but they are not required to do so. The university and our supervisors, we have the responsibility to make sure that we respect the privacy of the individual regarding this health information. So if the employee shares with you that they did test positive for COVID-19, you have a responsibility to respect their privacy in that area. Next. So contact tracing, lots of people want to know about that, and will it be able to be sufficiently completed? The Champaign-Urbana Public Health District, in partnership with the university, the health district is hiring additional contact tracers who will be dedicated to following up with our university-related cases. So that would be faculty, staff, or students who test positive for COVID-19. And so they are augmenting their staff. It is their responsibility to do this work. And on the university, the steering team is putting into place a structure so that we can be sure we are in good communication with CUPHD, so that if we need to take some unit actions, we will know when that is needed. One very important piece of information that I want everyone to know is that no one is required to quarantine unless public health contacts you and instructs you to do so. So again, simply knowing someone or having some casual contact with someone who tests positive for COVID-19, or being in the same unit or the same class with someone who tests positive for COVID-19 does not automatically mean you need to quarantine. Only public health can place someone into quarantine based on contact with a positive individual. The unit will be contacted by staff in our labor and employee relations area with any specific guidance around cleaning or notification. Next. So let me quickly go through a couple of scenarios. One is if we have an employee who tests positive, who has not been in the workplace for 5 days, there's absolutely no additional action the unit needs to take around cleaning, sending other staff home, or communicating to staff. If we have an employee who tests positive and they have been at work that day, then the unit should contact facilities and services. They've got a great protocol about enhanced cleaning. If there are others who share that workspace, they should go home until the area is cleaned that day. And in this case, we will work with you to send a standard notification because we don't want rumors. Last scenario, we have an employee who currently works 100% remotely, tests positive. There is no action that needs to be taken by the unit regarding this, because there's no risk for workplace exposure because they're not on campus. Next. This is the last question that we wanted to make sure to cover, and that is a lot of questions around what are people expected to do and what are the rules around quarantining after travel. So first of all, the reason for travel, whether it's personal or university business, does not change the guidance. It's the type of travel. So anyone who has traveled internationally, whether they're a current employee, whether they are a new employee who is just arriving from an international location, everyone who has traveled internationally is required to quarantine for 14 days from the date they enter the United States. Domestic. We know that there are places within the US in which they are not having the transmission rates that we are fortunate to have been experiencing here in our region. However, there is no Center for Disease Control or Illinois Public Health requirements for quarantine for domestic travel. And so there is no quarantine period for domestic travel. And the important message here is that as an institution, we are following the guidance from the CDC and IDPH, and units and departments, colleges. We cannot impose your own quarantine restrictions. We will abide by the restrictions from our public health agencies. Next. I think, Robin, it's back to you.
Great. Thank you, Deb. That was a lot of information. We really appreciate it. I know at some point throughout this, I'm going to ask somebody something that was probably in there, and I apologize in advance. But again, this is kind of one of those tell them what you're going to tell them what you told them kind of time. So thank you for humoring me if I have to do that. Elaine, let's start with you. Can you tell us a little bit, first of all, as you're making these HR decisions, what are the guidelines and principles on which you're basing them?
Thanks, Robin. We are very fortunate at the University of Illinois because we have the ability to rely on our faculty and staff, experts who are familiar with situations such as this and the principles that are attached to it. So we are doing exactly that. We are using a science-based approach to make our decisions relative to what we do at the university in response to this virus. University has a long history also of working collaboratively with the different agencies in town. And we are community partners with the Champaign-Urbana Public Health. We work also with the Center for Disease Control, the Illinois Department of Public Health, and our partners at the Champaign-Urbana Public Health District. And we do this to help us inform our decision-making. We've also worked with many people across the campus in a variety of different ways to use their assistance and their guidance as well. And we've worked with many people across the campus to review our existing policies and practices because we know that some of the changes we may be required to put in place will cause us to need to make changes in those areas. And so we are seeking out assistance in a scientific way. We're doing it from people who have familiarity to assist us in what is a very unique situation for us.
Great, thank you, Elaine. Andres, Deb went through the Illinois Community Pledge earlier, and I know we've had some confusion about it. Can you explain, does it mean I'm giving up any rights? Am I somehow indemnifying the university when I sign that?
Robin, as Deb made the point to emphasize, the pledge is not legally binding. Essentially what it is, in my mind, is a way to remind yourself of the COVID-19 etiquette that our campus will practice in order to keep everybody safe. It's just a way to not only educate yourself, but also to buy in that community commitment to look after the community in the best possible way. So no, it is not legally binding.
Great, thank you very much. And Leslie, I know we've had some concerns raised by employees. Our employees are very thoughtful and mindful about safety and how things should operate. How have we been responding to those concerns?
Our employees' health and safety are very important to us. And so we have many ways to get employee input, including emails that go directly to the COVID-19 dedicated inbox, through conversations with the faculty senate, conversations with the unions that represent our employees, and direct inquiries from employees themselves. We're listening to that input, and often we are making modifications based on what employees are talking to us about. The COVID pandemic has caused us to make a lot of changes in many of our HR practices, and we know we'll need to continue to make changes as we navigate this new landscape. And we're optimistic that we can continue to work together to find solutions.
Great, thank you, Leslie. Deb, I know you went through this in the presentation, but can you walk us through one more time what happens when there's a positive case of COVID-19 on campus?
Sure, Robin. So the most important thing is that the public health department will pick up the contact tracing, and they will really drive the process from there. If I could stress anything, it would be when you are contacted by a public health department because you are positive, they will give you very specific directions around isolation, and really you are required to follow their direction and be compliant with those isolation orders. So other than what I shared, I think that's the additional information that public health does a great job. We're very fortunate that they will be hiring additional contact tracers, and please be responsive if you are contacted.
Sorry, could not unmute myself there. I second your motion about the public health district. They've been wonderful partners for us, haven't they? So Deb, what happens if I get a positive COVID-19 test, but I am not currently on campus? Do I need to tell anybody, or is it no big deal?
So again, especially if you are working on campus, then you definitely need to let your supervisor know at a minimum that you will not be able to come to work for at least 10 days because of a medical condition. That's if you don't want to share specifically that you tested positive for COVID-19. We are working at putting into place a mechanism that employees can privately share at a more central level when they receive a positive test, particularly when they receive a positive test from someone who, other than our own saliva-based testing. That will help us all make sure that we're connecting all the dots with the contact tracing and assisting public health. So a little bit more to come on that.
Okay, but again, if I'm working remotely, I still need to let someone know if I'm not on campus.
That's a piece of what's still being worked out about the people who are completely remotely.
Okay,
But
great.
we think we will be asking everyone to let us know.
And I think that's an important point to make again, is that not everything is completely nailed down, that we're still working on details in the last few weeks getting here. I've been really impressed to see how all of the groups have worked on the things that have to go first, and then next and next and next. And I kind of liken it to if you're building a house, we've got just those few things left on a punch list. And it's pretty amazing to see everybody working through all those together. So now, Deb, let's talk a little bit more then about quarantining. So people who've been in close contact with someone who tests positive have to quarantine. Does that mean if I'm in the same building or office suite with someone who tests positive, that everybody in that suite has to quarantine, or everybody in that building, or what? Can you show me where the rubber meets the road on that?
Sure. And this is one area where we have seen a lot of confusion, and just COVID-19 is new for all of us. But I really want to stress that the answer to the question is, does everyone in the building or the office suite that when there is someone who tests positive, does everyone need to quarantine? No, everyone does not need to quarantine. Public health will determine who, if anyone, in the office or the building needs to quarantine based on their contact tracing and what they have learned from the individual. So again, that threshold is very specific. You have to be within 6 feet of the person for more than 10 minutes at a time. And so if you're keeping your social distancing and we're wearing our face coverings, those are going to be great things that keep us from meeting that close contact threshold.
Great, that's really clear. Thank you. So Elen, if I'm a supervisor and one of my employees comes to work and seems to be sick, what am I supposed to do? Oh, I think you still need to unmute yourself, Elen. It looks like we're having some technical difficulties with Elen. Deb, do you think you could step in on that one for us? And you also need to unmute. Oh, there goes Elen. There goes Elen. Okay. So again, Elen, I'm a supervisor and one of my employees comes to work and clearly seems to have symptoms. What should I do?
Well, I'm glad we have that question because it's a question that's been asked repeatedly in these last few months and weeks and recently days. So one of the things we want to remember is that we still want to be a compassionate employer. When people are sick, we do want to be supportive in some ways. But in the case of a person coming to work who is sick and in the midst of this pandemic, the question about what do I do under the circumstances, I need to start by saying that one of the changes that COVID has made for us and made us see is that we need a culture change about coming to work when you are sick. For the most part, we have a culture of workers and managers and supervisors in which many of our employees feel, and we sometimes as managers encourage this, that they should come to work even when they are ill, as long as they feel well enough to keep working. That is why we need a culture change. Now more than ever before, when employees are ill, we need them to stay home, and we need to encourage them as administrators. We need to encourage them to do so. That way, we can create a work environment that is free from illness as much as possible. And actually, this is pretty critical in order for us to protect one another. So we are encouraging that. So if an employee comes to work but shares that they feel ill, you should send them home. But let me say, that doesn't mean we don't want to still be caring and concerned about what they do regarding their welfare. So we should also do this. During COVID, you should also remind our employees to do a self-check for COVID symptoms and consult with their medical provider if they need to do so. Also, we need to remind them that we have a saliva-based testing and that it is available if they are having COVID-like symptoms. We need to remind them to wear face coverings and to practice the social distancing, especially if they're going to go for testing. If I have to stay, and under these kinds of circumstances, they need to use their sick leave benefits.
Okay, thanks, Elen. So Leslie, can you drill into that just a little bit more? So if I have to stay home because I'm sick and it's due to COVID-19, I get paid?
Well, before answering the question, Robin, I have to first start with a bit of a disclaimer, and that is that while we can provide general guidance for questions such as these, Illinois Human Resources, in conjunction with our unit HR partners, will have to evaluate every situation that's presented and will assess the factors of each situation to determine the appropriate answer. That said, and generally speaking, yes, assuming the employee has been diagnosed as positive for the COVID-19 virus, the employee will remain in paid status based on the following options. First, if an employee has been diagnosed as positive for COVID-19, and therefore the employee will be subject to a federal, state, or local quarantine or isolation order, that employee will be eligible for the Families First Coronavirus Response Act, which provides for up to 80 hours of emergency paid sick leave. This is new federally mandated leave, separate and apart from an employee's university provided sick leave or other types of accrued leave. Second, if for some reason an employee has already exhausted his or her FFCRA benefits, the employee will then be able to use his or her accrued sick leave benefits and other accrued benefits such as vacation, floating holidays, and accrued compensatory time. A couple of other points, or one other point, as we have learned, a person may have a positive COVID-19 test and be completely asymptomatic, or maybe won't get that sick. So if their job is suitable to remote work, that employee would continue to work remotely, just remain in pay status because they are working and not have to use any leave benefit. So again, it's not a simple yes or no answer. Every situation is unique and will be evaluated by unit and campus HR, but we are certainly committed to supporting our employees as much as possible.
That sounds great. Thank you very much. And I appreciate the thoroughness of your response. So moving along, so we're at work. I happen to see you, Leslie. I get near you and I see you're not wearing a mask. What am I supposed to do at that point? Although I know you would never not.
I would never do that.
Yeah, but if you did, what am I supposed to do?
Sure. You know, as has been made clear through all of these presentations, the university is emphasizing education and training as the initial response to a person who's not following our requirements, such as wearing a face mask or maintaining appropriate social distance. We are really looking to build compliance in our community. I do want to say employees are not expected to act as individual enforcers of our COVID practices. Rather, we really are trying to adopt an approach of we're a community and we take care of one another. That said, here are some general guidelines for this situation. Number one, we want every employee to always maintain their own social distance, meaning they need to keep at least 6 feet away from the other person. Number two, if an employee feels comfortable doing so, they certainly are free to inform or remind the individual of the campus guidance about our different practices that we're adopting. You might point out if there's signage nearby that would help illustrate the point. That would be something an employee could do. And it probably would be a good idea for the employee to notify their supervisor or perhaps someone that has responsibility for the building or the office, and just let them know, and that person can determine what steps, if any, should be taking. We will be issuing a document very soon that has more specific guidelines on this issue. And the main point here is to remember that every employee should focus on their own safety and their own well-being. And remember, this is a community effort, and we're doing our best to support and take care of one another.
Great, thank you. And when you have that document ready, we will certainly share it on the covid19.illinois.edu website. So Leslie, I've got one more question for you.
Okay.
If people aren't being compliant, what happens to them? So I don't have to be the one to enforce it, but what is going to happen?
Again, as I say many times in labor and employee relations, no single answer. We have to look at every situation uniquely. As all of our communications have emphasized, we're first and foremost encouraging self-compliance and voluntary cooperation. We're all in this together. We need everyone to follow our practices, such as social distancing and wearing a face covering, in order to keep our campus safe for everyone. So generally speaking, we will address initial instances of an employee not following our requirements through educational conversations about the matter. If, however, the employee continues to not follow our requirements, we will then move to formal disciplinary procedures that are appropriate for that particular individual. In all cases, and as we always do on our campus, we will follow the principles of just cause and due process.
Great, thank you very much. So Deb, in your presentation, you talked a little bit about people coming back and not coming back to campus. So not everybody's going to be back August 1st or August 16th or something, or is there a date? What?
Right, there is no one standard date that we're going to hit the easy button and say everyone's back in their office on this date. That will depend on what is the nature of the work. Can the work continue to be completed remotely? If so, again, we're encouraging that for a number of reasons to assist our employees who are going to have their school-age children home for maybe part of the week. Maybe they return to their campus location on the times that their students are in school. However, if the position requires that the individual be at work, then yes, we will have positions where we're going to require that the person be back on campus in time to provide those services, especially those services that are critical for our students as they are returning to campus in just a few short weeks.
Okay, thank you. Elin, the Chancellor and Provost have been really clear that as we, throughout this, that as we address this, we were going to have three sort of guiding principles. One was that the safety and well-being of our campus community and greater community was going to be our main priority, that we were going to be innovative in finding solutions to this problem, and that we were going to be continuing to move on our mission. And if we continue to move on our missions, that means there probably need to be some hiring decisions made. Can you tell us a little bit about whether hiring will be allowed in fall 2020? Oh, and again, I think you're muted, Elin. I'm sorry, that button is just not cooperating, is it? You're still muted. Oh, I don't think it's working. Let's see. Can you try one more time, Elin, or should we see if Deb could take that one for us? See if you can unmute one more time. I think we're having some technical problems with Elin. Deb, could you take that one for us about hiring for the fall? Thank you.
Sure. We will continue to have hiring throughout the fall semester and beyond. In the spring, we implemented some new hiring guidelines to be very intentional about hiring in strategic ways. We're always strategic in that, but we have added in some additional layers of review for certain types of positions, but we are continuing to hire. We have been hiring even since the spring, and we'll continue to do so where we need to.
And can we talk a little bit again about, you mentioned travel and international. Obviously, we're a global university. If I travel to a high-risk area in the US or to an international destination, do I have to self-quarantine when I return before I go on campus?
If you travel internationally, yes. And that's a 14-day quarantine, and that 14 days is standard for everyone. And the clock on that 14 days starts from the date that you enter the US. So for domestic travel, and boy, we have gotten this question a lot in the last 2 weeks. Domestic travel, again, unless and until the Center for Disease Control or Illinois Department of Public Health puts in a restriction requiring quarantine after traveling to specific places in the United States, there is no quarantine for domestic travel. The one thing that I can share is, because we do have our saliva-based testing available, if you travel domestically and you wish to have peace of mind for yourself after you return, certainly I would encourage you to go to one of our testing sites and be tested.
Great. It does sound like, Deb, that if I forget anything specific that you all have said today, that if I just try to think about being part of a community and being kind and being thoughtful of my colleagues and my friends, that I'm probably going to figure out the right approach.
That would be a great approach to take, Robin.
Okay, and Elin, we're going to see if we can get that microphone to work for you. Let's see here. And
I am.
Okay, I think you're there. That's great. And I like your masked IT man there. Thank you, Mark.
Yes, yes.
So Elin, as we wrap up, I would like to hear a little bit about what you have learned from this. I know as we've talked to other administrators throughout the series, everyone has said that there have been things that they've encountered and ways they've had to adapt that they think might change how they operate in the future. And I know you guys have had to do, as Andrea said at the beginning, a lot of things that other people haven't had to do. So have you learned some things that might help us be even more efficient and better and stronger in a post-COVID world?
Certainly we have learned a lot, and I believe that there is no question that we have identified things that we see that we can do differently and be responsive in a short amount of time. But when I'm asked this question of how to reflect what I have learned from this, it has been interesting because COVID-19 has caused us to reflect on how we do our work. When the governor sent that order in and said, go shelter in, we had to move very quickly to bring our employees away from the campus and into what we believed would be a safer environment. And the experience we encountered was that all across our campus, our staff, our students, everyone began to pull together to create that opportunity for people to leave the campus and yet figure out how to still make that campus operate. It's caused us to reflect on how we get our work done and our organization. And where we have changed practices and found that they benefit the university as well as benefiting our employees, we will not revert back to doing business the way we had done just because the pandemic is over. So while we would have never asked for this experience has truly taught us some very guiding things about ourselves, about our work, and how to do things differently, but more importantly, how to do our business for the university in all areas differently and better. For instance, how we clean our buildings, which employees can actually successfully work remotely, and how we can quickly respond to an unprecedented crisis. The amazing work that happens on this campus, like our saliva testing, the efforts to manufacture hand sanitizer in a short amount of time to respond to an immediate need, the development of a ventilator prototype, and to deliver a high quality educational experience for our students in spite of all the things that were happening on the campus. I've been on this campus a long time, and I have to say, the experiences that we have encountered, the support that we've received all across the campus, the concerns, the creativity that we have developed, I don't think I could be more proud at this moment to be a part of the University of Illinois at Urbana at any other time.
Oh, bless your heart. Thank you very much. What a lovely sentiment. Andreas, top that. See if you can close us off for the afternoon.
I cannot top that, Robin. That I cannot, but I want to say a couple of thoughts. First of all, I think what we heard here is how much work our HR folks have been putting into looking after everything, all the things that we can anticipate, all the things we cannot anticipate, those things that we cannot answer, seeking out and finding ways in which we can answer them in such a way that we look after every person that constitutes what the University of Illinois campus is all about. And that is not only our faculty and staff, our instructors, but also our students. And I say this because at the end of the day, even though I know we do not have all the answers, what the experience over the past few months working with HR to anticipate everything has taught me is that A, we should not be afraid to ask questions. B, we should not be afraid to say, well, I do not know the answer to this question. And C, we should not be afraid to say, well, what should we ask? And the first person we should ask is the one that question matters to the most. And I think we have practiced that very religiously. And it shows how we have been able to advance our thinking about the future of this university, not only as we still navigate the uncertainty of the pandemic, but also as we look ahead. I think we are becoming much more human-centric. We are becoming much more sensitive to the individuals that make the university happen. And I think that is one of the things that will stick, because at the end of the day, all of us care for one another. And I look forward to not only the fall semester and beyond and putting COVID-19 behind us, but all the lessons we have learned because of COVID-19.
Well, very well said. So I just want to thank all of you. Our time is up. Andreas Kangelaris, Vice Chancellor for Academic Affairs and Provost, thank you so much for all you have done to lead us in this really difficult time. Elin Cole, Senior Associate Chancellor for Human Resources, Deb Stone, Executive Director of Human Resources Policy and Administration, and Leslie Arvan, Senior Director of Labor and Employee Relations. You and your entire staff, and as the Provost said, all of the HR staff across the institutions have been amazing. And I know those are often very thankless jobs, so I would just like to say on behalf of all of us, thank you to all of you. Also want to thank our colleagues in Public Affairs, Allison Vance, Chris Harris, Brian Mertz, Katie Watson, and Andrew Gleason. In Tech Services, I want to thank Brian Boyle and Scott Van Wingerden, and Teresa Harvey and Mark, the masked man with the unmute button, Overmeyer, and Illinois Human Resources. Thanks to all of you. Our next briefings in the series, as I said, will be the week of August 3rd. That's when we plan to have sessions on the scientific modeling that 2 of our faculty have done, as well as a session for students. And of course, their parents are welcome too, to talk about what you might want to think about as you prepare to return to campus for those of you who are coming back. Again, that'll be at the same link as today, and all of the briefings will be recorded and posted on the covid19.illinois.edu website, and they will all be captioned. Have a great day, everyone, and we will see you in a couple of weeks. Thank you.